What do you think is the #1 cause of personal bankruptcy in the United States today? It's medical care bills. In an effort to reduce costs and make access to medical coverage much easier and more affordable, the Affordable Care Act, commonly known as Obamacare, was passed. Originally hailed by many as a lifesaver, it now has some people wondering whether or not the cure is worse than the condition. Finding the answers to commonly asked questions hasn't been easy. On this segment of Wellness Spotlight, we're pleased to have Tab Chakunta, Executive Director of Community Outreach at St. Peter's Healthcare System, and Michelle Lucas, Manager of Resource Services at St. Peter's University Hospital. They'll help us learn more about the Affordable Care Act and whether or not it's right for you. Tab, Michelle, welcome to the Wellness Spotlight.
Thank you.
Thank you.
Tab, how did they create your position?
Well, you know, St. Peter's is a hospital that has a lot of interest in the community. And some of the things that people think sometimes is that people know how to access hospitals. That's an assumption. And that everybody who needs a hospital knows how to get into the hospital system. St. Peter's doesn't believe that. St. Peter's believes that we should go into the community, to the people, find out their needs, ascertain those needs, come back to the hospital, and make the hospital work for the people. And that's basically what I do.
What challenges have you found in community outreach work?
Apart from the fact that it's an endless work, and I love it, but you know, it is really interesting to realize how diverse the communities are. Communities are unique and very diverse. And all the needs are not the same. So I am trying to ascertain the needs of individual populations and take it back to the hospital to make sure we respond appropriately to their needs.
And what's been the response?
It's been great. As a matter of fact, we have been nominated for some great awards, but that's not how we measure ourselves. We measure ourselves from the response of our patients and our community leaders. They are saying to us, you care enough to send somebody to come into our homes and ask us, what do you need? The response has been great.
Thank you.
Welcome.
Michelle, how did you become an expert in the Affordable Care Act, in Obamacare?
I think it's a thing as far as expert, that term you can use a little loosely, but what we've tried to do is be ahead of the curve so that we can help our community and educate them as to what these changes mean to them on a personal level. Healthcare is complex as it is normally, and if you don't feel good, on top of that, trying to have to figure out the financial part of it, which is difficult. There's no one brochure that helps somebody. So our team does that and assists them through many different programs. Not only those that would help them with their billing per se, but help them as a person. So if we become aware of somebody, for example, that may have issues with their heating, we'll refer them to the proper program, trying to get people to the resources that are there for them.
Now, when it comes to Obamacare, most of us were unable to be able to get information because the web portal was down. You couldn't get online to be able to find out anything. How did you learn what you're about to tell us today?
Well, St. Peter's University Hospital was very proactive and started throughout the summer obtaining information and working towards becoming a certified application counselor organization through the CMS, which is the Centers for Medicare and Medicaid Services. So we partnered in order to get that information and be prepared for October 1st for the open enrollment of the health insurance marketplace, as well as determining those that would be eligible under the Medicaid expansion. New Jersey is one of the states that is participating in that expansion.
So in other words, the hospital getting into this program would permit the hospital and its physicians to be able to treat anybody who's insured under the Affordable Care Act, is that?
Well, as far as the application counseling organization is concerned, what we were trying to do is be able to assist our communities, our patients, our family members, our friends, all the folks that come to see us on a daily basis to get them into the program that best suits them. And from there, they were able to then make that decision as a consumer, what fits their family, what fits their lifestyle, what fits their healthcare need. with regards to coverage.
And is there any fee for this service?
No, there is not.
And you don't make any profit from it? You're not selling
No, and we're
insurance?
precluded from doing so. No.
Right, okay, so this way you get a very objective opinion or information that's not biased.
We're there to guide people through the process. And it has been challenging from October 1st. As you said, the website was down. But we've worked around that, assisting patients via paper method, being able to give them information. And unlike a lot of other programs, this is such a complicated thing for so many people that maybe never had any interaction with insurance coverage before in their life. A lot of people are coming, getting information, going back, reviewing it, coming back again, asking more questions. So it's happening over a period of time.
I see. And let's start at the very beginning.
Okay.
For people who have had very limited insurance coverage or who are looking into this for the very first time, can you speak briefly about what the Affordable Care Act is?
The Affordable Care Act was produced in order to help cover all those that are uninsured. There's a mandate mandating that everyone that does not have insurance coverage must have insurance coverage at a high level.
That's 18 or older?
That's just in general. Anybody that is a United States citizen must have
Regardless
health
of
coverage,
age.
regardless of age. And so towards that end, there was an expansion of Medicaid so that those that are in a less income level would be able to be qualified that prior were not. In addition to that, the health insurance marketplace was established so that folks have a place to go to get comparable, affordable health coverage. Associated with that, there are obviously different variables with regards to lifestyle, whether someone's a smoker or a non-smoker, with regards to the family size, what have you. But there are different subsidies available that once they go through the process, they may be eligible for to apply towards that premium.
Who is eligible to sign up for Obamacare? Is it just people who are financially challenged, or can anybody sign up for it?
Anybody that does not have health insurance is encouraged to apply through the health insurance marketplace if they were once screened out, not eligible for Medicaid. Those folks that are outside that range, and that would be above the 133% federal poverty level, up to 450% federal poverty level. Those folks, we want to try and get into the marketplace for eligibility.
And would you know what percentage of the population in Middlesex County would be eligible for something like this?
It's a significant portion of the population that are eligible for expanded coverage, whether that is through Medicaid, because Middlesex County does have a large Medicaid population already, with even more folks eligible now. That would be the parents of the children, for example, that may be on family care that prior were not eligible are now eligible. Single adults that perhaps before were receiving general assistance, Medicaid, which is a program in which they receive only a monthly stipend with minimal coverage, would now receive like a full service Medicaid package. Those folks are being auto-enrolled by the Board of Social Services beginning in January for coverage. So there is an extensive population for that. And then as far as the health insurance marketplace is concerned, there's quite a number of people that don't carry insurance coverage, that perhaps were being covered through different state programs that would supplement but not give them the full array of coverage that the marketplace will.
So for a person who is tired of paying tens and thousands of dollars a year for health insurance coverage for them and their family and wants to get a better deal through Obamacare, from what you've just said, am I right in understanding that they can't do that? They have to stick with what they have and continue paying those premiums?
If their employer currently offers them benefits that are considered reasonable, affordable, and coverage-wise meet that requirement, then they would not be eligible. This was really for folks that did not have that type of coverage already in existence. Mm-hmm. And so now that marketplace is available for them to pursue coverage through.
Now, what about for not all employers pay for their employees' coverage? Some employers just offer the coverage and may split the premium with the employee if the employee wants to opt for it in lieu of a higher pay grade. can that employee who has not opted for insurance go under Obamacare?
If that person currently does not have health coverage, and their coverage that they're being offered is not meeting that defined criteria of affordable and reasonable and customary with regards to the coverage package itself, then they have the option to go to the marketplace. But again, with the marketplace, there's been, as it's been in the media so much as well, with regards to the different components of the marketplace and folks that maybe are not now working full-time. Their hours have been reduced to below 29 hours, so their employers aren't offering them that coverage anymore. Yes, those folks would then be eligible to go to the marketplace. These are all trends that we've seen starting to happen as far as May, where people's hours were being reduced, they were losing coverages, different things were occurring where we've seen an increase of folks that we've just needed to assist in general. And that's before the marketplace coverage would begin January 1st for those that apply before December 15th.
I see. So coverage under Obamacare is unrelated to the number of hours that you're working. Part-time workers can get it as well as full-time workers, provided that they don't have coverage anywhere else.
Correct.
I see.
But there are a lot of businesses that have reduced the hours of their staff to below a certain threshold, which precludes them for the need to offer that benefit. And so because of that, you've had influx of folks that are coming and looking for guidance as to where to go for help.
As of this taping, the numbers are starting to come out that show that only a fraction of the people that have been eligible to sign up for Obamacare have actually done it. I know the government was saying that by this time they were expecting about 800,000 people to be signed up under it, but it's been much less than that. Why do you think that is?
It's a two-pronged issue. I think the first thing was on October 1st, as I had said, we were prepared to see a number of folks coming in. At that same day, the government shutdown began. So I think a lot of times people took the impression that because the government shut down, everything was shut down. So that reduced the amount of folks that perhaps would have come in general. That aside, that was then compounded with the difficulties that the website has had. It's not a big secret that the website's had its quirks and bumps, and we've worked really hard to assist folks in other methods, whether that be through the direct number to the marketplace or on a paper application.
Can employers abandon the current coverage that they have to be able to realize savings and buy plans under Obamacare for their business and their employees?
There's a small business component to the marketplace, but that's something that we really haven't become involved with or focused on because we're really dealing more on the individual side.
I see. There's been some talk about whether or not you can keep your physician if you switch plans. What's the answer?
The answer is I can't tell you the answer. The answer would be it's depending on if that physician is a provider under the plans that are being offered. In New Jersey, we have 3 plans being offered, which is Horizon Blue Cross Blue Shield through the marketplace, AmeriHealth, and then the Health Republic of New Jersey, which was a co-op program. New Jersey was one of 24 states that developed a co-op plan, and that's administered by QualCare. If their physician currently participates in that product, then it would make sense that they would be able to remain, but not necessarily can you say and paint everybody with the same brush and say, yes, that physician pars.
How can these companies offer coverage under Obamacare at such a substantial savings when we're buying coverage from them privately and paying so much more?
The idea with the health insurance marketplace was that the premiums that are allotted based on, again, family size, history with regards to smoking, non-smoking, that kind of thing. There are subsidies available that can offset advanced tax credits that can offset the price of a premium for somebody. And that not necessarily would be offered in a private sector or in a private pay situation.
Are these federal or statewide subsidies?
The subsidies are based on the federal.
Federal subsidies, I see.
It's an advanced tax credit that somebody could choose to either take at the end of the year or take and apply to their premiums to offset the cost. Because like anything, when you see the cost of something, in particular in healthcare, people get sticker shock. Oh my gosh, I can't believe how much it is. But what happens is that if someone is able and eligible for that advanced tax credit and choose to take it to the premium, apply to that premium, it'll lower it significantly. Not in all cases. You can't paint everybody, as I said, with the same brush. Everybody's individual needs and situation are different, but overall it would reduce that price.
I see. For an individual to go into the marketplace and buy health insurance, there's so many different types of plans that are out there.
Right.
I remember years ago when I first opened up my practice, it seemed like there was just one plan and that was it. There was a $100 deductible, there was unlimited coverage, and no reviews of any kind, no co-payments of any kind once that $100 deductible was met, and that was it. But now, you know, plans are as individualized as the people who buy them. Under Obamacare, do people have that same range of choices too, or is it basically a bare bones plan that gives them something and it's better than nothing?
Well, under the Affordable Care Act, under the health insurance marketplace, there are plans based on the Olympic tiers. So it's platinum, gold, silver, bronze. And then based on those plans offered by each individual insurance carrier, there's a percentage of coverage and a percentage that would be a co-insurance or a cost-sharing amount. So if someone was to decide, I want to purchase the platinum, which would be the largest one, it would be 90% coverage with a 10% out-of-pocket amount, and then so on and so forth down the line until you reach bronze. There's also a catastrophic plan, and that was created for those folks that maybe just got out of college, haven't gotten their first job, or just started their first job yet, up to age 30. That would be a minimal coverage type of plan, but would allow them to have well visits, but they have some coverage if needed. So it is varied with regards to what that individual family may or may not need. But under the Affordable Care Act, well visits no longer will have co-payments that would be involved, and someone's no longer precluded from coverage if they have a pre-existing condition.
I see. And what types of services would be covered under well visits?
Normal visit to your doctor for your annual checkup, services with regards to children going to see their pediatrician for their normal well visit checkup, and for women's services in specific, that would be part of that checkup as well.
But as long as that doctor participates within that plan?
Correct.
I see. And there's no co-payment for that, as you had said?
Correct.
Okay, that's great. And how often can people go for these well visits?
Normally it's annually, but I wouldn't want to specify or say something incorrect with regards to that because each insurance plan is different. So.
Now, as far as medical treatment is concerned and the cost for medical treatment, how do the deductibles run under these different level plans?
It's something that I really can't answer directly, only because it is specific to the person that is purchasing that plan. So it's not that I don't want to tell you, it's just a hard thing for me to isolate to say this is what it would be.
Okay, can those deductibles be linked to a health savings account or a flexible spending account?
I know that there are health spending and flexible savings accounts, and we've seen people more and more over the years utilize them. As far as how that's linked to offset that cost, if that's coming out of your pocket and you already participate with that, I would imagine you'd be able to do so. But I haven't seen that linked directly.
If somebody wants to buy health insurance under Obamacare, can they go to a regular insurance agent and purchase it, or must they go through the federal government's insurance portal on the web?
Well, New Jersey is a state in which we did not set up our own exchange. New Jersey is a state in which we are following the federal exchange, so somebody would go to the marketplace for that directly. There are businesses, there is a small business component to the marketplace, and there are agents involved with that, but that component we're not involved in because, as I said prior, we were trying to work with our community, our individuals, our families that come to our facility. So that was where our focus was, and that's something separate.
Under Obamacare, are there people who review the care plans that doctors recommend? Are there care paths that the patient must follow based upon the doctor's diagnosis? And is it very closely regulated as it has been under managed care?
As far as that, the intricacies of that, we haven't gotten to that place yet. Right now, we're trying to get as many people enrolled into the programs for which they are eligible as we can. And again, open enrollment goes until March 31st of 2014. So with regards to that type of treatment plan or what have you, I would imagine it would mimic what regulations already in place. I'm not aware of anything specific to that at this time.
Yeah, in addition to what Michelle is saying too, the need to have people enrolled, the more people we enroll, the quicker we can get to those specifics that you're asking about. St. Peter's is actually soliciting volunteers from the community. And we are pleased that there are community groups, religious organizations, civic organizations that have stepped up to the plate to say, we will send you volunteers and you will train them. And when those volunteers come to us and go through the process as volunteers, Michelle trains them and are now able to assist us in registering people.
I see.
The more people we can register, the sooner we can begin to move forward.
Are there services that St. Peter's Hospital will offer under the Affordable Care Act that other hospitals are not going to be offering?
I don't want to say that would be the case, but I think what St. Peter's has done differently than other facilities is that we've taken a real proactive approach on behalf of our community. We're a Catholic organization, and we take our mission seriously, and we knew it was important for us to be ahead of the curve for our community, both education and able to provide that service, because that's all part of our mission.
You know, there must be challenges involved in being able to implement something like this. Can you describe briefly what some of those challenges have been and how you've overcome them?
Well, from the community outreach point of view, it has been the tremendous amount of phone calls from people who are confused. There's a lot of misinformation out there.
Mm-hmm.
That's true.
A lot of misinformation. So people are confused. They call the hospital. And as Michelle said, because St. Peter has been proactive, because our mission is to serve the community, we are one of the first hospitals in New Jersey to be certified, to be a certification center. And we began to train our employees and began to train volunteers from the community. So we have received, as you would imagine, a larger percentage of phone calls from different community groups, including, I think, some healthcare organizations, asking for direction from us. So that has been a challenge for us. And then when the website went down, as Michelle had explained, kind of made it a little more difficult. But we have made 2 places available for people to come to the main hospital and to our family health care center on 123 Howland. So we set up 2 different centers to try to meet up with these demands.
And if somebody goes to St. Peter's Hospital for assistance, where do they go and who do they speak to?
They go to our resource services department. If you're going to the main campus, that would be in the main admissions area. Our area we call resource services because that's what we are. We're trying to provide resources to the folks that need them. Sometimes some areas may call them financial counselors. Sounds like you did something bad, it was financial, you needed counseling, and that's always a barrier to somebody who really needs help. You want to be welcoming, not excluding. So we're mindful of that, and so we're available there, and as Tab mentioned, at Howe Lane at the Family Health Center.
Thank you.
And you know, Ken, one of our major missions is to reach everybody in the community, regardless of their religion, their culture, regardless of anything. As such, we are even pondering how to assist and serve those who may not be proficient in English language, who English language may not be their first language of choice. And we are working now on trying to recruit volunteers who speak other languages and work out a way of training them as well so that they can assist.
So as the Director of Community Outreach, Tab, if organizations and businesses are interested in getting more information or programs that they could bring to their business or to their groups, how do they get in contact with you?
They can go to our website, which is on the screen, or they can call me directly at 732-745-8551, or they can call Michelle at your number, which is
6056. The main number to the hospital, 732-745-8600.
And are there any brochures or printed materials or information on St. Peter's website to give people additional information?
yes, there are.
Yes, there are.
And can you describe what some of these pieces are? We can show them up on screen.
We have brochures that came directly from the marketplace that gives a background as to what the program is. It also, there's different illustrations that give how the marketplace works, broken down so that somebody can understand it in pretty limited terms. You know, the idea of the marketplace, the idea of the Affordable Care Act was supposed to be simple, and then things kind of got more and more complicated. So sometimes it's the best way to explain something is in simple terms, and that's what those are.
Yeah.
And they're available in an array of different languages.
As we wrap up, what would you say would be the place that somebody should start? What questions should they ask themselves in order to be able to get better answers for themselves?
What are the needs that I have for my health care? What is my need? What are my needs financially? What do I have now? What's a need and what's a want? And what's best for my family? And if you can identify what you have now, or if you have nothing and what it would be, then you'd be able to go in and ask those questions in a more pointed way.
Great. Tab, any parting thoughts?
You know, it's important to add, Ken, again, because of the mission of St. Peter's to serve the community. And despite the challenges, you know, in healthcare these days, financial, every organization is facing that. St. Peter's has committed funds to support the resource management services that Michelle runs, laptops and different technology, to make sure that we are able to meet up with the demand and the volume. We believe that this is one of the major services that every hospital should provide, and that's why St. Peter's, you know, became very proactive to serve the people.
Thank you. Tab, Michelle, thank you so much for being here with us today. I could just imagine how busy both of your schedules must be, and we really appreciate you taking the time out to be able to help us navigate this very complex subject.
Thank you.
And thank you so much for having us and for getting the word out to the community.
Yes.
You're welcome.
Thank you.
This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. As we're in the holiday season, before we closed, I just wanted to take a moment to thank all of the viewers for tuning in over the course of this year. I hope that we have really helped provide you with the information that you need to be able to enjoy a much healthier life for you and your family. I'd also like to thank all of the volunteers at the Advisory Health Council for the time and the effort that they give in helping East Brunswick be a healthier place in which to live. On behalf of the Advisory Health Council, I'm Dr. Ken Friedman, President of the East Brunswick Advisory Health Council, thanking you again, wishing you all the best this holiday season and in the new year to come, and especially reminding you that wellness works when you work it.